talk about it. Today, we're delighted to have one of the major CIRSE papers and the main author, which is Professor Dimitrios Filippiadis from Athens. And the paper is on the CIRSE Standards of Practice for Classification of Complications. And this is a modified CIRSE classification system. I would like to ask, first of all, Dr. Filippiadis, why a classification of complications is important for IR, and what is the contribution of this paper to our community?
A clear classification of complications is essential in interventional radiology because it directly impacts patient safety, quality of care, research consistency, and communication across clinical teams. Interventional radiology procedures are diverse and complications can vary widely. A classification system provides a common language for radiologists, surgeons, nurses, even for administrations. Keep in mind that classification allows meaningful benchmarking and quality improvement. And regarding research, consistent complication definitions are crucial for designing clinical trials, for comparing outcomes across studies, and for publishing reproducible results. Last but not least, classification of complications guides clinical decision-making, because with this classification, we can help determine whether a complication requires intervention or not, how urgently it must be treated, and whether the patient should be monitored, admitted, or escalated to surgery.
What is new in the current classification system, and which are the main merits that this system actually brings?
The 2017 version of the CIRSE classification system was published with the goal to standardize complications reporting by avoiding subjective definitions and an excessive number of grades. Now, the current modified CIRSE classification improves the original system by clarifying the gray zones, especially regarding hospitalization and incomplete procedures. We realized that short-term outcomes like spending 1 or 2 nights in the hospital, they do not truly capture the patient's experience. What matters the most is the long-term impact. If a complication means that you cannot return to your favorite sports activities, that affects your quality of life. With respect to this approach, we divided grade 1 to distinguish between complications that were solved within the same session and the therapeutic session was concluded, and complications that were solved within the same session, but treatment was not performed as a result of the complication. Similarly, we subdivided grade 3 to 3A, which involves a hospital stay longer than 2 days, whereas grade 3B involves a hospital stay longer than 2 weeks. Both have no sequelae, meaning that the patient in both cases, in both clinical scenarios, can return to their normal life and to their normal activities.
Fantastic, that's very clear. Now, clearly, as IRs, we are sort of similar to surgery specialty, and we don't really invent the wheel. Clearly, we tailor the classification system in our needs. What are the main actually similarities and differences among our novel system and the main surgical classification complication system?
And I would like to emphasize mainly on the differences. The surgical classifications are less adaptable to minimally invasive procedures. The definitions of reintervention, of no harm events, of mortality, they actually differ. The modified CIRSE classification system is a system made by interventional radiologists for interventional radiologists. It incorporates imaging guidance, endovascular or percutaneous therapies, device-related complications, and mostly it focuses on the hospitalization and the impact of a sequelae to patients' life. In the near future or in the midterm future, hopefully we will be able to have a common global interventional radiology system for classification reportings. This is not about competing. This is about cooperating and coordinating in order to reach this goal.
Well, thank you very much for sharing this very important cardinal paper of CIRSE and in CVIR with us today. Thank you for clarifying the main aspects of this paper, and I would encourage everyone to have this paper in their armamentarium, read that, because clearly classification of complication is of paramount importance for what we do in our everyday practice. Thank you very much, Professor Filippiadis. Thank you once again.
Thank you so much for having me.